So we're going to talk about ophthalmic medications or eye drops. There's quite a few eye drops that we use during a routine eye exam or at a follow-up. So we're going to talk about how to put the drops in and what each of the drops are used for. So anytime that you're going to put in drops in a patient, you want to make sure that you're educating them on what type of drop that you're putting in, what the drop is going to be used for, and if there are any side effects at all from that drop that they're going to experience, whether it burns or it stings or it causes blurry vision. You want to make sure that you tell that all to the patient beforehand, before you put the drop in. So the first thing you're going to do is always make sure that you wash your hands. So anytime that you're going to be touching the patient, especially around and near their eyes, you want to make sure that your hands are clean. And I always do that, even if I've already washed my hands before I came in, I always do it again in front of the patient just so they make sure that they know that your hands are clean. So you wash your hands. You're going to take the eye drop that you're using. Obviously remove the cap, tell the patient what you're going to put the drops in for, and make sure that once this is opened, this is obviously sterile, so it's going in the eye. So you need to make sure that this tip, once the cap is removed, does not touch anything, you don't touch it, doesn't drop on the floor or touch the patient's eyes. It's very important to keep that tip sterile and make sure that it's not touching anything. You never want to leave drops laying around without the top on either, for that same reason. So I always take a tissue and give it to the patient because they're going to need that when you put the drops in. Remove their glasses if they're wearing them. You're going to have them tilt their head back slightly and instruct them to look straight up. That's going to allow you to pull down the lower lid, which makes a pocket here in the eyelid that allows you to put the drop in. So have the patient look up, take the lid off, keep looking up. You're going to come in here in this little pocket that's formed in the lower lid when you pull it down. That's the best place to put in the drop. You never want to put the drop on the cornea, which is over top of the brown or the blue part of the eye, because that's the most sensitive part of the eye and it will be very uncomfortable for the patient. So pull the lid down and you want to come in nice and close. You want to make sure again that the tip does not touch the eyelid at all, but you do want to get it close. You don't want to drop it in from way up here because again, that can be very uncomfortable. So looking up, and you're going to apply the drop down in here in the lower part. Same thing on the other side. You're going to pull it down and you're going to drop it in the lower part. So on the lower part of the white part of the eye or within that pocket in the eyelid. And then you can instruct them that they can gently clean the eye, usually close the eye and gently blot each eye. You don't want them to get in there and really rub the eyes because that can cause damage to the surface of the eye. Right, so now we're going to talk about the different types of eye drops that we will use during the eye exam. The first one we're going to talk about is topical anesthetic, and these can come under different names. This one is tetracaine. There's also proparacaine. Really anything with the ending cane is usually an ocular anesthetic, topical ocular anesthetic. And what this is used for is to numb the surface of the eye. We use this for a lot of different reasons. If a patient comes in with a foreign body or something in their eye that needs to be removed, or their eye is very painful and you're having a hard time examining the eye, you can put in this drop. It can also be used when inserting punctal plugs. And sometimes we do insert the drop prior to other eye drops. So if other eye drop stings very badly, you can put in this drop first, and that will numb the surface of the eye, so then you can instill the other drop and you won't feel it. The second drop is a combination drop. We use this to test the eye pressure, and what this is a combination of a dye, so a yellow colored dye called fluorescein, and a topical anesthetic. So it's a combination drop. And you always know it comes under some different names. This one's flucaine. There's also fluoresce. But you always know it's the drop that we use to test eye pressure for glaucoma because it has this little dropper on the top. So it's a little different than the other drops. So with this, you're going to remove it. You see it has a dropper on the end. So you're going to squeeze the dropper to get the eye drop up into the dispenser, and then you're going to apply it by squeezing the dropper, and a drop comes out one at a time. This you need to be careful because it can stain, so you want to make sure that you're not holding it over top of the patient and letting it drop anywhere near their clothing. And again, this is used, it numbs the surface of the eye, but it also has a dye so that when we test eye pressure, we use the gold manometer with the blue light, It allows us to visualize while we're checking the eye pressure. The next is, it's a little different. It's strips, and they're called dye strips. And what these are used for is to add dye or a coloring to the surface of the eye. And we use it most frequently in patients who have dry eye or a corneal abrasion, and it helps to highlight if there's any defects or problems on the surface of the eye. These are the two main ones we use. One is called BioGlow, which is a fluorescein strip, and the other one is called Lissamine Green, which is a green colored strip. And in order for these to work, what you need to do is you basically rip them right here in half, and you can see the strip is this long strip in the middle. So you're going to rip the paper on the top and the bottom and then kind of pull the end off, and that allows you to keep on the paper here to hold the strip, but this is the top where the dye is. So the dye is kind of on top of the strip. And in order to activate the dye, you want to use this eye wash. So no other drops or solutions, no contact lens solution. You really want to use the eye wash. And you're going to come over near the sink, and you're going to apply a couple drops of the eye wash onto the surface of the strip until you see it start to drip with the dye. Then this can be applied to the surface of the eye, and this is the only scenario where you're actually going to touch the surface of the eye, because this, once it's used, you throw it away. So you do want to apply it either to the very lowest part of the white part of the eye in the conjunctiva, or actually on the inside of the eyelid. If you pull it down, is the best place to apply it. And you do one in each eye, and then you're going to dispose of the strip in the garbage. If you have a patient who has a suspected eye infection, you want to make sure, in one eye, you want to make sure that you use two separate strips. You don't want to apply the dye strip to the eye that's infected and then apply it over to the other eye, because you could spread the infection. So that's the only case where you would need two separate strips. But in regular patients who you don't suspect an eye infection, you want to go ahead and use the same strip for both eyes. The next drops we're going to talk about are drops that are used to dilate the eye. And we have two different ones. We have one called tropicamide and one called cyclopentolate. But you'll notice that the common thing between them, they look very, very similar, the bottles, and they both have a red top. So pretty much every eye drop that's a dilating drop, which is used to dilate the pupil so that the doctor can look inside the eye and see the health of the eye. All of those drops are going to have these red caps, so they're very easy to locate and find. So the first one we're going to talk about is tropicamide. That's the drop that we use routinely for dilating the patient's eye. So this one you want to tell the patient, again, what the drop is, what you're using it for. So this drop is to dilate the eye so that the doctor can see inside the eye and see the health of the eye. But very important with the dilating drops is to make sure that they understand that the drops are going to make their vision blurry, especially for near. That's how I word it, because sometimes the patient's vision can be a little blurry for distance as well. But this drop is going to stop their focusing system and make them and a lot of patients make them unable to read, and the distance can be a little blurry for a few hours. The drop is also going to make their eyes sensitive to light. Again, because it's dilating the pupil, it's making the black part of the eye nice and large so we can see inside the eye. That also prevents the pupil from constricting when there's sunlight. So their eyes are going to be sensitive to light. This drop, the tropicamide, takes approximately 20 to 30 minutes to work on the eye. So before I put the drop in, this is exactly what I tell the patient. I say, I'm going to dilate your eyes. That's going to allow me to look inside the eye and make sure everything is healthy. These drops are going to take about 20 to 30 minutes to work. They will make your vision blurry, especially for reading, and make you sensitive to light for the next 2 to 3 hours. And again, you want to tell that to them before they put the drop in, obviously. The other drop is cyclopentolate. So this drop is used only when either prescribed or instructed by the doctor to use. And it's very similar to the tropicamide in that it does dilate the pupil. But the big difference with cyclopentolate is it really stops the focusing system of the eye more so than tropicamide does. So we will often use this drop in kids who we suspect maybe have an underlying prescription, And we want to really stop their focusing system completely so we can determine what that underlying prescription is, because kids have a very active focusing system. And oftentimes with the tropicamide, they can still have their focusing system working, which can affect their prescription and the results of your eye exam. So in some situations, it's necessary to use cyclopentolate. It's stronger and it acts longer than the tropicamide. So if you are using cyclopentolate, you're going to let the patient know basically the same thing that you tell them for tropicamide, but the big difference is that the actions of the blurred vision and the sensitivity to light and the dilation of the pupil are going to last for 24 hours. So instead of 2 to 3 hours, it does last typically a full 24 hours. So that's very important to let patients know for their kids' sake, because that can affect them for the next full day and sometimes into the next day. So if you put in cyclopentolate at an exam 4 or 5 o'clock at night, they're still going to have the effects the next day. So it is very important that you let them know that the effects are going to be significantly longer.